how does Chinese medicine think about the mind-body connection? This is something that's become very crucial to our sort of modern integrative medicine movement. In fact, it's probably one of the ideas that has instigated it early on. Chinese medicine does not even assume that there is a separation between mind and body, ever. From the beginning, it regards the human being as a single entity that has different aspects. We have a mental aspect, we have an emotional aspect, we have a spiritual aspect, we have a bodily aspect, but these are all sides of the same coin. You can't point anywhere and say that's the mind and that's the body, or that's the spirit and that's the body. Chinese medicine views the person as an embodied intelligence, an embodied spirit, in which all parts of the organism are intermingled. So some of the classical descriptions, for example, of what we would call mental illness, the Chinese would describe as the spirit fleeing from the body, or the spirit wandering away from the body. So that this intermingling, this coherence that we keep referring to, is somehow sabotaged. So Chinese medicine calls this the intermingling of mind and essence, or Shen and Jing. And this intermingling, or this unity, occurs at conception. So when the sperm enters the egg and the life of a new individual is initiated, that unity is there a priori. There's never a separation. There never was, and there never will be. The separation means death. So the mind is yang and the body is yin. But in life, yin and yang are not separate. They're like this. If there's a separation, or if they're beginning to separate, in Chinese medicine, that's considered to be a very critical sign of impending death. So the mind-body connection is not only crucial to the thinking of Chinese medicine and the practice, it's simply a presumption. There's no such thing as a non-connection. And if there's a non-connection, we're not alive. So a person in a coma, for example, is considered to be very close to being dead, even though that physically they're alive. Sometimes we can bring those two back together, bring that integration back together and perform what may appear to be a miracle. Harriet had a patient once. She didn't have a patient, but she had a friend who was a Chinese medicine doctor who had a patient, a young girl in a hospital who had been in a coma due to a fever, due to an infectious illness. And she'd been in a coma for several weeks. And the prognosis was very poor. So the parents asked our friend, this Chinese doctor, to come in and give her herbal medicine. So he fed her herbs through her nasogastric tube, and within days she was revived and returned to herself. So using very physical means, herbs, substances, we're able to bring the mind-body connection back together for this young girl. But we see this all the time in practice, in our daily practice with patients, that acupuncture, almost without exception, produces a sense of what we would have to call wholeness in patients after they experience it, after every treatment. People feel more like themselves. They just feel themselves. Feel like yourself. You don't have an arm here, or a head there, or a brain here, or blood circulating there. You're just you, right? So when you feel like you're just you, just yourself, that's the goal. So that's mind-body integrity right there.
Our book, Between Heaven and Earth, A Guide to Chinese Medicine, is an overall source of information about how we think about Chinese medicine, how we explain it, and how you can learn more about it.